Going into 2020, we were focused on several key strategic initiatives around patient satisfaction, quality, growth, and team member engagement.
Beginning in January and February of 2020, I had a couple key focus areas. We wanted to deliver clinically excellent care. That came in a couple forms. We wanted to deliver high quality care. Our second body of work was related to population health. And population health is something I'm particularly passionate about. It's about keeping people healthy so that they don't develop complications and need higher end services.
When I first heard about the virus in January, it caught my attention, but I didn't know what to expect because at that point it was basically in China. As it spread to Europe and then we started seeing cases in the western part of the United States, that's when it really got my attention and I realized this is something we're probably going to have to deal with.
We knew we needed to get ready and we needed to prepare. So the BayCare leaders began planning and preparing for really the unknown. None of us had done this before.
We actually set up a task force very early on in January to be ready to react to the virus if it landed in Florida or, heaven forbid, in our 4-county area that we served. With that structure, we were able to have all of BayCare, our vast 4-county areas, all of our team members, our physicians, even our community elected officials and community agencies all working together in a coordinated fashion to help the community deal with this crisis.
We did exceptionally well in standing up our testing locations in the community. I'm really proud of the team across BayCare that worked together to do something that we had never done before, which was drive-through testing. And it's one of the examples of our great teamwork and our innovation at BayCare and meeting the needs of the community.
The second thing was, do we have the personal protective equipment, the masks and the gowns and those types of things necessary to protect our team members, the physicians, and others to prevent the spread of the virus. And we felt at that point that if we continued doing elective surgeries, we'd be using up PPE that could otherwise be used to protect our team members and others inside the hospitals. So for that reason, we made the decision to shut down elective surgeries on our own, and then coincidentally, the governor made the decision for the rest of the state within a week later.
Patients and consumers became very worried about their symptoms early on in the pandemic. They weren't sure whether they had COVID, didn't have COVID. And so one of the things we did very quickly was stand up a call center staffed with BayCare nurses who had never been in that kind of position before, talking to patients on the phone, calming the community, informing the community, and providing them much needed information when there was a lack of information early on in the pandemic.
The nurses, the frontline caregivers, really were turned upside down because what they did at work, nothing was the same as it once was. The fear that nurses have had in facing and caring for patients with COVID-19 has been tremendous. So our leaders have really worked hard to provide communication, support, leadership.
When we came out of that first, what I call the peak or the first increase in COVID cases, that's when things became challenging because we had to get back to business. We take care of patients who don't have COVID. So we went back to our plan, what we focused on in 2020, focusing on clinical excellence, focusing on delivering holistic care.
We've been obsessed with COVID, but in spite of that, it's amazing to me how much we've gotten done. One of the areas we paid a lot of attention to was a lot of consumer-focused initiatives. We've created a central pricing office that helps people understand how their bills work. We've created a consolidated billing statement that puts all their bills in one place so they can pay them just like they do their credit cards. We've expanded telemedicine to make those services a lot more easy and accessible. We've also continued to expand access in our community. We finished a big project at St. Joseph's Hospital that involves a new tower as well as a pedestrian bridge that connects the main hospital to the women's hospital. Another thing that was key is that we broke ground on a new hospital in Wesley Chapel and made a decision to build a new replacement hospital in Plant City.
You know, as I look back over 2020 and the entire year, I'm most proud of this organization and the way 30,000 team members and 5,000 physicians came together, unified around a single purpose. Taking care of the community, improving the health of the community that we serve, 3.8 million strong.
We've never dealt with a pandemic before, and the team, the physicians, everyone stepped up to the challenge and really did a great job of meeting the needs of the community.